If you or a loved one are struggling with type 2 diabetes, you should visit the link in the description below. This clinically proven, drug-free program lowers blood sugar to a normal level and can completely reverse type 2 diabetes within just a few weeks. Here's today's video.
The question, why does diabetes cause rapid weight loss? Answered by Ron Hunter. So, I'm going to assume that you're talking about type 1 diabetes. There are two types of diabetes that are distinctly different metabolic disorders. The answer to your question is the effects of insulin in the body. When type 1s lose their production of insulin, their bodies no longer are able to store fat or even utilize what blood sugar is being produced by the body. This causes the body to basically consume first fat and then even lean muscle mass. If you look at left-hand picture of this type 1 before the discovery of insulin, you'll see the emaciated look of someone starving. The picture on the right shows a more normal body weight after insulin injections were started. So, for type 1s, the lack of insulin can cause rapid weight loss. The lack of insulin causes the body to start basically eating itself. Type 2s can lose weight if their bodies stop producing insulin. However, for most type 2s, things work in reverse. They have a problem with insulin resistance caused by too much insulin in their system. Too much insulin normally causes the type 2s to store fat and gain weight. That's the connection between type 2 diabetes and obesity. Answered by Kunal Sharma. Diabetes and sudden weight loss. In people with diabetes, insufficient insulin prevents the body from getting glucose from the blood into the body's cells to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing a reduction in overall body weight. Unexplained weight loss is the term used to describe a decrease in body weight that occurs unintentionally and can be a warning sign of diabetes. The amount you weigh is determined by a number of factors including age, your calorie intake and overall health. Once you reach middle adulthood, your weight should remain relatively stable from year to year. Losing or gaining a few pounds here and there is normal, but unexplained weight loss that is significant, 10 pounds/4.5 kilograms or more or over 5% of your body weight, or persistent may signal an underlying medical condition. Unexplained weight loss means weight loss that occurs without trying through dieting or exercising. What are the possible causes of unexplained weight loss? Unintentional or unexplained weight loss can be caused by a number of the things, including depression, certain medication and diabetes. In people with diabetes, insufficient insulin prevents the body from getting glucose from the blood into the body's cells to use as energy. When this occurs, the body starts burning fat and muscle for energy, causing a reduction in overall body weight. Unexpected weight loss is often noticed in people prior to a diagnosis of type 1 diabetes, but it may also affect people with type 2 diabetes. When to call your doctor. If you have unintentionally lost more than 5% of your normal body weight, or more than 10 pounds, 4.5 kilograms, in 6 to 12 months or less, you should consult your doctor. They will be able to determine what's causing the weight loss, e.g., undiagnosed diabetes, and the best way to treat the problem. If you have any queries regarding health-related issues, feel free to contact us at WhatsApp number 9,530,069,900. Our team of experts will provide you with accurate and relevant information and try to give solution to your problem. Hope I am able to answer your question. Answered by Jessica Spitty. Unexplained weight loss is the term used to describe a decrease in body weight that occurs unintentionally and can be a warning sign of diabetes. The amount you weigh is determined by a number of factors including age, your calorie intake and overall health. Once you reach middle adulthood, your weight should remain relatively stable from year to year. Losing or gaining a few pounds here and there is normal, but unexplained weight loss that is significant, 10 pounds/4.5 kilograms or more or over 5% of your body weight, or persistent may signal an underlying medical condition. Unexplained weight loss means weight loss that occurs without trying through dieting or exercising. What type of diabetes causes weight loss? A reduction in insulin resistance is problematic because insulin is needed to help glucose enter these tissues to be metabolized. If these tissues are resistant to insulin, higher than normal levels are needed for this process to occur. This is often the case in type 2 diabetes. As a result, a vicious cycle occurs. The higher the insulin levels are, the harder it is to lose weight. Insulin is anabolic, and is a hormone that likes to store fat. On the other hand, the heavier a person is, the more likely they are to have higher insulin levels. As you can see, the cycle is often hard to break. What causes unintentional weight loss in diabetes? While intentional weight loss in people with diabetes is usually a good thing, unintentional weight loss is not. If blood sugars are very high, patients with diabetes tend to urinate a lot, and this results in dehydration as a possible cause of weight loss. Also, muscle breakdown can occur if sugars are too high, causing an unhealthy weight loss. Actually, many patients with diabetes present for the first time to their doctor's office because of unexplained loss of weight. In addition to diabetes, there are other concerning causes of unexpected weight loss which should be explored, such as thyroid disease and cancers. In summary, a supervised attempt to lose weight in people who can exercise without risk is usually of benefit. However, in certain cases, such as if blood sugars are too high or too low, or if heart disease is present, it can be dangerous. This is why all exercise and weight loss programs should be started only after discussion with a physician. Any unexplained weight loss in patients with or without known diabetes may be a sign of high blood sugars or another serious illness. It is absolutely necessary to see a physician and undergo a complete evaluation in these cases. Weight loss is a common recommendation for treatment for type 2 diabetes. Many people are overweight when they're first diagnosed, and that extra fat actually increases their insulin resistance, when their bodies can't properly use the hormone insulin. By losing weight, people with type 2 diabetes can become less insulin resistant, and they're able to use insulin better. To learn more about how the hormone insulin works, read our article on how insulin regulates blood glucose levels. If you've recently been diagnosed with type 2 diabetes and you are overweight, you should get started as soon as possible on a weight loss plan. It is important to work with a registered dietitian to help you figure out a plan that will work for you. A healthy meal plan, physical activity, and realistic goals will help you reach a healthy weight. Reference: is weight loss caused by diabetes dangerous?